Hey, Jim Hoffman here for EMS Office Hours and the Monday Minutes. I know I've been a little remiss and missed a few weeks here of catching up on the EMS quick study resources here, but I wanted to kind of get a few of them done in a row for you so I can really get these out there to you, because we're going to start getting into some of the content that I think you're going to be finding much more interesting, because it's part of the content you can be using more often out in the field, right? So we're going to start with poisoning and overdose. This is episode 26, and it's actually chapter 26 in the EMS quick study guide as well. So it kind of fits in together, and I think it really, that was nice that it kind of made that chapter and sequence match up. But as always, I ask you why you think this is important. I know why it's important. It's important for examination prep for one thing, but of course, to me, it's more important because it prepares you to be a better clinician out in the field, okay? It lets you kind of understand what's going on with patients, and to me, while these are short, quick study tips and content, my hope is that you will go ahead, if you don't understand something or if something kind of rings a bell that you want to find more information out on, that you'll go ahead and crack open that big textbook, do some Google research or use a resource like turbomedic.com, and go ahead and do more research on this content and better prepare yourself when you do get a patient that might come into something like this. In this case, of course, poisoning and overdose. And believe it or not, we do get quite many of these in EMS. And if you've been in EMS for a while, you know that that is actually the case. So real quick on an overview, we're going to talk about what poisoning is and give a little description. And poisoning, the way you're going to maybe look at it or see it on exam, is that exposure to a substance that's harmful and it's not going to have any beneficial effects. Okay, that's what poisoning is usually described as when you look at it from a text point of view. And overdose, this is that excessive exposure to a substance that normally has regular uses in treatments, right? Prescription drugs and things like that. But this is something that is gotten too much of, right? That's usually what overdose is described as on a textbook basis. And if believe it or not, nearly half of overdoses involve prescription medications. Okay? Now, what types of these like toxicological emergencies that we're looking at? We have the unintentional poisoning, things like dosage errors, right? Is accidental by nurses, doctors, family members, even the patient, or even us if we're not careful, right? You get the idiosyncratic reaction. Those are the unpredictable side effects that you might see, okay, from giving a drug or someone taking a certain drug, okay? Or how about childhood poisonings, right? We're going to see these. These are when maybe you've got inattentive care going on to a child, or maybe the child's curious about what's in that bottle, right? Of course, is why we've got child-proof caps and things like that. These are actually the most frequent calls, believe it or not, the childhood poisonings to poison control centers. Then, of course, we've got environmental exposures or occupational sort of exposures, right? Those type of emergencies and those type of poisonings you might see as well, depending upon where you work and kind of chemicals you're exposed to, or environmental, what type of plant life you might be exposed to, right? And then we have neglect or abuse. There's a little bit of a fine line here, between neglect or abuse. But again, it's a way to be a patient might get poisoned unintentionally. Now, I want to talk, when I talk about before about how we see a lot of poisonings in EMS, right? Well, drugs and alcohol, or that substance abuse, right? Alcohol abuse. These are calls we get to as far as poisonings, and we might get there and with the patient not necessarily at that level of being poisoned by the drug or poisoned by the alcohol or the substance abuse, but they're going to have illness or they're going to have injuries related to that, right? So, and there's millions of dollars that are spent every year on these injuries and illnesses that are coming secondary from drug or alcohol poisoning, even low levels of poisoning. Okay, and if you've been in EMS for a while, you get a lot of calls for the drunk patient, right? The intox, the ETOH abuse, right? So keep that in mind. It is technically considered a poisoning or an overdose. I want to talk a little bit really quick before we wrap up this session about the intentional poisonings, intentional overdoses. Well, we have chemical warfare, right? And it's worth mentioning. You might not see that, and you probably won't see it in your EMS career, okay? But it does include weapons of mass destruction. It does include terrorism, right? That can be used. So that is sort of an intentional poison and worth listing as an intentional poisoning, right? Of course, and then we've got the assault or homicide. And this is where people might use poison on somebody else, okay, in order to commit murder, in order to kill somebody or to harm somebody. And then, of course, suicidal poisonings. This is deliberate exposure to a substance that the person knows, okay, a known poison to them or a known overdose of a certain drug that is going to try to kill them or actually kill them, okay? And keep in mind, guys, there's a lot of different things that can go on here. We talked earlier about the alcohol. You can actually try to kill yourself from drinking too much alcohol, okay? So keep that in mind, all right? I'm going to end it here because this chapter really goes into depth about a lot of different things when it comes to poisonings and overdose. This is just a quick overview of, unintentional and intentional, okay? And kind of a little description for it to kind of get us started on this topic. All right, so next time we're going to talk about the routes of absorption, and we're going to talk also about specific types of poisoning, and especially when it comes to things like geographical type, sort of types. Okay, where you're going to see, different types of poisonings depending upon where you might be. Things like snakes and spiders and things like that. So we'll get into that next time on the office hours. I hope you can use these Monday Minutes. I know a lot of times these are very general, very basic, but I'm hoping that, again, it triggers your desire to go and look further. All right? Be sure to follow me, guys. I'm on all the social media channels. Check me out on Instagram. Check me out on Facebook, and check me out on Twitter as well. You can use the domain name emsseo.com/Instagram, Facebook, or Twitter, whichever one you want to join me on. Okay, these are all forwarding links that are attached to the social media platforms. And also, follow me on Snapchat. Okay, follow me there, friend me there, or friend you back. My handle on Snapchat is EMS Safe. All right, so I hope to see you on any or all of these social media channels in the near future. All right, guys, that is it for me. Please, if you have any questions, comments, want to see something here in the Monday Minutes that I haven't covered yet, or want to hear more about even, let me know. Send me an email, okay, or tweet me if you want. Even, send me a direct message on Twitter, okay? Send me a message on Facebook, whatever you're comfortable in doing, or shoot me an email. That email would be contact@emsofficehours.com. All right, guys, that's it for me. Until next time, I am Jim Hoffman for EMS Office Hours and the Monday Minutes. Stay safe.